On the day before your surgery, you will need to make sure that you are fully prepared. First of all, it's important to double-check what time you have been advised to arrive at the hospital. This can be found in your admission information. Next, take care following any fasting instruction given to you during your pre-assessment and confirmed in your admission information. When packing your bag of essentials, we strongly advise that you only bring what is necessary, leaving all valuables at home to avoid them getting lost or misplaced. Don't forget to pack all of your regular medication too. Try not to leave too much to prepare on the night before your surgery, as you may already be feeling anxious. It may be better to use this time to focus on your well-being. With everything prepared, remember to have a good nutritious meal before your fasting period starts. On the morning of your surgery, it's strongly advised that you take a shower or bath and thoroughly brush your teeth. You should also continue with your recommended fasting regime. Unless told otherwise, when you arrive at St. George's, you'll need to check in at the Surgical Admissions Lounge. You can bring someone with you, but don't forget to give their details to the reception desk, as this enables the surgical admissions to be able to notify them as to where they can find you. When you are checked in, you will be seen by several professionals who are all involved in your surgery. You will see your nurse. They will initially check that your personal details are all correct, before issuing you with an identification wristband. Final health checks will also be carried out. Once these checks are complete, your nurse will give you a set of compression stockings, a robe and a theatre gown. You will see your surgeon or a senior member of their team. They will ask you any relevant questions, go through their surgery plan, and further discuss your consent form, ensuring that any more questions you may have are answered. Once that is confirmed, they may mark the area of the operation on your skin with a felt-tip pen, if required. You will see the anaesthetist, who will rediscuss your medical history and any medication you are currently taking. With all your surgical admissions lounge checks completed, it won't be long until the theatre are ready for you. A nurse will notify you at the correct time, and now you will be required to change into your theatre gown, robe and compression socks. As well as to protect your modesty, the compression socks will also help reduce the chances of blood clots and deep vein thrombosis occurring. Personal belongings will be locked away whilst you're in theatre. These will then be handed over to you on the ward. The nurse will now accompany you to the theatre suite. However, your next of kin can only accompany you as far as the theatre suite door. Your theatre nurse will now book you in for your surgery and carry out the final identification and safety checks. You may be asked to wait in a waiting area before being taken to the anaesthetic room. Here, the anaesthetist will insert a cannula into your forearm to administer your anaesthetic. Once this has fully taken effect, you will then be transferred into the operating theatre, where your surgery will begin. When you awake from your surgery, you may have an oxygen mask and various monitoring equipment attached to you. While this may appear to be alarming, don't worry, it's completely normal. It is also common after surgery for patients with medical problems to be cared for in the high dependency unit or intensive care unit. If this applies to you, then you will be informed by your anaesthetist or surgeon at pre-assessment. You will stay in the recovery area until you are ready to be moved to the ward. If at any point you're in pain or feel nauseous, please let someone know. When you are ready to leave the recovery area, you will be collected by a ward nurse and transferred to your allocated ward. Your loved ones will have been informed they can visit you here